do you have a gun?
Adam, I have been a dog, but what is your question for? What is this relevant to you?
It's relevant to me because on January.
So I'm questioning. So why it's relevant? I asked for your question. Yes, I have a dog. So why it's relevant? I want to know.
Okay, doctor. Before we continue, I want to tell you that I was an inpatient in the VA hospital in Oklahoma, January 11th, 2026. I can't hear you. I see you.
Told me that you were a patient on January 11th in Oklahoma.
Yes, doctor, I did. Is there another doctor that I can speak with as well, or do you have a partner that you work with?
Well, the options that we have, if you don't want to receive care with me, I can ask in the office if they can transfer you with another provider. There is usually like waiting list. The other options that we have is care in the community. There is any particular reason that you would like to speak with me?
So I want to explain that I was in the VA hospital, an inpatient, January 11th of 2026. I went there by a freak accident. I was attacked, mauled by a kitty cat. So I had to have surgery. And while I was there, doctor, in Oklahoma, and I don't mean to have a bad tone, they kept running the same commercial over and over. What they will do for white men with PTSD who have gun charges is get them their guns back. I just now sat here and told you that they took my twin granddaughters from me. You understand what I'm saying? So that's what we want. That's all I want to talk about. I want to talk about how to get my twin granddaughters back, how to get them from Oklahoma, because that would make me crazy. I'm telling you that a corrupt judge, and if this is too much for you, I'm just saying that's the help I'm here for. I don't know. That's respectfully. I don't mean to be upset. I said all this in Oklahoma. I said all this from Oklahoma. I won't move to Maryland. I am moving to Maryland because of the VA system there and the people there versus the culture here. Okay?
So I want to be, respectful. My job here is just to be able to help veterans, and I'm very passionate about my job, okay? So I'm here to help veterans, but one of the things that we do here in the mental health clinic, it is like, right now, in terms of the legal aspect of for you just having your granddaughters, we don't intervene in legal matters. The only thing that we provide here is services for mental health disorders like anxiety, depression, PTSD, personality disorders, other things, and then I can do referrals for medication. So my role here, it could be maybe in this situation, it is like, I can see this is causing a lot of stress, right? And what I can do here is maybe just provide you with skills to be able to manage like your anxiety, if this is causing anxiety, like
yes, rage.
My role here. Besides that, there is nothing, I can't do anything related with the legal matter for you in Oklahoma and to recuperate the kids. So this is a mental health clinic, and that's the reason that I need to gather some information regarding your mental health history to see how we are able to help you with this distress that you're going through. So, and I have the question that I asked you was like, if you have if in your knowledge you are diagnosed with anything specific, any diagnosis of mental health?
Yes, PTSD.
With PTSD, besides PTSD, anything else? In your knowledge, anything else that you have been diagnosed?
Petite malls.
Okay. Okay, and then I have a question. Do you take medication for your PTSD, ma'am?
Not really.
No, not really.
But yes,
not really.
I'm manic.
Have you, are you willing to,
oh my God.
For medication?
Why do I need medication when I know what my problem is, when I know that white supremacy is stealing my grandchildren, and I know that Joe Rogan can tell the president we can get mushrooms. I'm not the fucking one crazy unless y'all making me crazy. I want my grandchildren, I want everybody to know what the fuck is going on in Oklahoma and stealing my grandkids. And if I don't get my grandkids back, I'm going to be on medication. I want to speak to the person that's in charge of women's health. I watched a video, I just told you, I sat in the hospital in the VA, sorry to yell, and watched them tell white men that they will give them back their fucking guns when they got PTSD. I want my grandbabies. Their mother just died. I can't believe you. I can't believe the women today. I know what you do. I hear what you do. Didn't you just hear me? I don't need medication. What?
I'm hearing you. And my question wasn't to tell you that you need medication. It was like...
I don't want to discuss medication. I'm sorry. I'm annoyed by discussing medication. And I don't... No offense to you, doctor. Once again, no offense to you. I said all this back in June. I'm not about to go down some other rabbit hole with some medication bullshit. I got 2 6-year-olds. Some medication. And I'm sorry for the cuss word. Again, I say that because I said this story already. This is a heartbreaking story. It's wrenching me. I can't see how drugging me out is helping anybody. Me, my kids. You know what the medication need to be? It need to be working out, walking, getting some air, being a decent person, and meeting decent people. Now somebody trying to push drugs. I'm telling you about white supremacy taking my grandchildren. You tell me what drugs I want to get on today. Girl.
No, I'm asking questions because it is my job as part of the mission.
And I'm telling you, I'm annoyed by the questions on medication.
So, and I know that you can be annoyed, but you need to understand something. We are here. I need to be able, in order to be able to help you, I need to be able to do my job. And this is not something like personal to you. This is something that I have been doing for the past 3 years. And the same question that I'm asking you is the same question that I usually ask to all the veterans. So this is part of the process, and I need to determine how I'm able to help you here in the mental health clinic. So as I explained, in the mental health clinic, the only thing that we can do is related to mental health disorders. But let me ask some general question just to see how you are connected with the VA here in Baltimore and see how we could be able to connect you with different services, okay?
Yes, Doc.
I have a question. Do you have a PCP, a primary doctor assigned in Baltimore? Have you already transferred all your care? Have you seen older doctors in Baltimore VA, or am I the first one that you are seeing?
So you're my first, but I will be getting set up at the VA in Baltimore.
In the VA, okay. It will be good that you just started doing all your transfer, your general care, right? Just to do your lab, just to see everything, because all of this stress can be affecting different areas, right? Of your health in general, and we want to make sure that you're connected.
Yeah. And I did get a full workup in January when I was put in for the CAT.
Okay. And but at that time, if I recall well, you were in Oklahoma. That's correct.
That is correct.
Does that happen? Okay. So they did all the tests. Okay. And here in Baltimore, do you live by yourself?
I do. I live by myself at this time. I have a home and a heart that can take 2 grandkids in it.
Okay, so you live by yourself, and then do you have other family members here in Baltimore?
I have many families here. I was born and raised here. I got family on the jet.
Born and raised in Baltimore. Okay, born and raised. Okay. And do you usually, with your family, do you have contact with them, the family that is in Baltimore?
Yeah, when I feel like it.
Okay, so you can call that, they could be a support system for you?
Yes, they can be. And so can new people that I meet.
Okay.
And they can be a pain in the butt, their family.
Mm-hmm. That sometimes with family, interactions sometimes can be challenging.
This point in time is very challenging because it's me or the white supremacist And the white supremacists, in some people's opinion, got all the power.
I can understand your frustration.
Yeah.
And I have a question. You say that you were diagnosed with PTSD. Have you had treatment for PTSD before?
I have. Absolutely. I think I just discussed it in my rant just now. What I believe is better than fucking drugs. Selling drugs to the goddamn veterans.
I know that you're frustrated, but let's just try to. I know that this is part of your frustration.
I'm sorry.
I know it is part of your frustration, okay? But I'm trying also to feel you here. Okay?
You do not deserve to be talked to like that. That's correct. Yes, ma'am.
Okay, and then let's see here. Tell me more about, like, do you have, how many children do you have?
I have two grown sons, a 40-year-old and a 37-year-old.
Both male?
That's what sons are. I'm sorry. Yes, ma'am. Okay. They're both male. I'm sorry, ma'am. I'm sorry.
Okay. 40 and 30. And then, so you have to, 40 and 30, and then your grandchild that you're trying